All righty. Well, Congressman and House Majority Leader Kevin McCarthy, thank you for joining us here today. Obviously, the big topic of discussion in the national political scene has been health care, the repeal of Obamacare. Listening to your earlier conversation just a moment ago, there is so much discussion about the CBO, the 24 million Americans who will be potentially off insurance by the year 2026, 14 million by just next year alone. Politically speaking, so many experts weighing in on this bill that's been introduced right now. Do you have enough votes in the House to even clear the House? And can you even get this through the Senate and onto the president's desk to be signed into law?
Yes, we'll clear the House. If you look, it has passed Energy and Commerce, it has passed Ways and Means, and it just passed the Budget Committee today. So next week it'll go to the Rules Committee before it comes to the floor. And we have to realize what this bill is. If you have health care today provided by your company, this does nothing to you. If you have Medicare, this does nothing to you. It's only those that are in the exchanges or Medicaid. And then if you have Medi-Cal, which is Medicaid, for the next 3 years, there's no changes in that process. And during those 3 years, what we do is we provide the states greater flexibility so they can manage the population, because right now it's unsustainable into the future, and we want to make sure we protect Medi-Cal for the future. Now, if you're in the exchanges, what you have found, many people across this country, that there are fewer options. So what we're allowing the individual, instead of the government picking what plan you have, that you get to choose the plan. And there'll be a lot of competition in there, and there'll be different plans. Maybe you just want a catastrophic plan, or maybe you want one with just braces because your kids are younger, or maybe you want something to deal with as you get older. Well, you can go in and pick that plan, and based upon age and need, you get a tax credit for that to actually pay for part of that if you need it in the process. So that provides, and what the CBO said was, it's going to lower premiums. And so many times I've heard that from people, that they want health care they can actually afford and stop the rising cost of what health care is. Now, when it comes to people and their projections of saying people will not be knocked off of health care, remember what their projections were when it came to Obamacare. It was way off. They would said there was, I think, somewhere around 29 million that would be on it. Well, that's not the case. It's somewhere around 10. So what we have going forward is, yes, we repeal the individual mandate. So there might be some people that don't want it, but they're going to have so many plans out there that maybe they'll take one of the smaller ones because it'll cost less. Also, we give an incentive in here for people to stay on health care. Much like if you're a good driver, you get a different rate for your insurance. Well, if you stay on the health care plan continually, you'll get a better rate than those who try to come off it and come back on.
And you're confident, Congressman. There are a lot of people watching the inner workings of this bill, specifically people here in Kern County. The number's a little less than 100,000 people in some form of Medi-Cal receiving some sort of care through that program. Are you confident that there will be no disruption to those folks' care? And if there is, and if there are concerns, do you plan to address those? I mean, there's been calls for a town hall here at home in the last few weeks, more than a month now, in fact. One, can you promise those folks they will not lose coverage or have disruption? Two, any plans to address concerns in some sort of public venue to vet out these concerns people have?
Oh, yes, very much so. What the bill does, California is one of the states that expanded. There are no changes to that for the next 3 years. And during that time, the state, and this is where I had 18 governors, Democrat and Republican in, and the number one thing they asked for was give us flexibility. So it gives them flexibility in the process. But it has no changes in the process. As you go forward, to those who are on Medicaid, the same amount of fund that the federal government provided will still be provided in the process. The difference going forward after 3 years, the new people who are coming onto Medicaid, the federal government will not be responsible for 95% of the payment. It will go back to what we have continually to pay for the blind and disabled, that same amount. And that's what we continue to pay during Obamacare. Now, when it comes to addressing individuals, I'm always open to that. And what I've been doing while I've been in Washington is having teletown halls where we call people at home and they can ask whatever question they want. And an interesting little fact happened. Inside these calls, I took a survey where people can respond back what is the best way that they would like to be communicated with or have, what type of town hall. And more than 78% of the people on the phone said they like teletown halls better in person. But I will continue to move forward, and I'll hold different forms of town halls in the future, and I'll have a town hall meeting in the future, no problem.
And as we discussed earlier, our invitation still stands, Congressman, on a virtual town hall that we've offered to you in some sort of Facebook Live capacity or some sort of live streaming capacity. So that'll still be on the table, of course, on our end to you. David Valadeo, a colleague in Congress, held one-on-one meetings. It was published in the Los Angeles Times. He saw, obviously, what you mentioned earlier, these town halls and gymnasiums and in large venues turned into shouting matches. He didn't think they were productive. He decided to have one-on-one 10-minute sessions with constituents. You think that's a good idea? I know that these telephone town halls, you have the conversations, but I think the sentiment here in town and in Kern County and Bakersfield specifically is people want a face-to-face meeting with their congressman, and are you prepared to do that?
Oh, very much so. I do meetings all day long, and especially when I'm in Bakersfield as well. I have no problem going forward with that. It's something I continually do. And when you sit and talk about those that are in healthcare, so if you look at from Kern Medical, or you look at the process who actually runs Medi-Cal in Kern County, I've sat down with one-on-ones with the hospitals, with those who are running it and others. And as we go through the process, I want to make it productive. As you've watched so much across this country, and one item that individuals have been taught politically how to go and disrupt, I want people who come to the town hall meeting to be able to have their questions asked and answered. And I think that is a more productive amount. So I will do all the above forms of ways that I can communicate. And I think that's the best way. I should be held accountable. I want to make sure I'm able to listen to everybody. We may not always agree, but I want to make sure I answer your questions. So you'll find, even because of time difference, late at night, I'm calling people just as I did last night because somebody emailed me on Facebook, just responding to what their questions were. It might be a time difference, but I'll continue to respond every chance I can. And we continually do mobile office days continually.
Right, and on that note, and to be fair, I believe you're opening up a mobile office in Tehachapi in the near future. Is that correct, to reach out to constituents there?
Yeah, this is not new. If you watch, I've always had mobile office days. I've always done teletown halls where we're going through. I've always been open in the process. Maybe it's on radio. There's so many different ways to communicate. And yes, one-on-one as well is how I want to communicate. So I have no problem. I think that's a responsibility that I have to have. The difficulty here is that in the last work period, a group politically decided that I should have a town hall on that day. But unfortunately, I had worked for the last year to bring Condi Rice to town to raise money to fund the after-school programs for the Boys and Girls Club. And as you know, the Boys and Girls Club in Bakersfield is the largest Boys and Girls Club in the nation. And so I have already had something planned to fund that and to help that, and I worked more than a year on it. Unfortunately, I couldn't go on the day they picked and the day they wanted, but I'm always open to communicate in any day in the process.
And back to the politics of this healthcare bill, again, you're confident that you mentioned it cleared budget today. It's going to go to the Rules Committee, I believe, this week or next, and then possibly for a vote. When could that vote happen? And are you confident that this version of the bill will pass, or is this going to be a working motion piece of legislation that we see change as we go forward, or is this the bill that you think will pass?
Well, I think when it goes to Rules Committee, there will be some amendments taken for some changes as we continue to listen. And like any legislative process, it continues to improve as it goes. And when it goes to the Senate are legislators too. They can change it, they can offer amendments, they could do whatever they're going to do, and then